Now, there was an article that was written from New York Times, and it was written about organ donation. It's called "A Push for More Organ Transplants, Putting Donors at Risk," and it's basically like saying just a bunch of bullshit that like there's financial compensation if you get organs, kind of like alluding to hospitals basically just wanting to like kill people for their organs, right? And I can say with my credentials, having worked critical care for numerous years, I've done numerous consults to organ procurement people. I mean, the amount of patients I've taken care of on vents that are critically ill that weren't going to make it off, having taken care of organ donor patients, and having been in several procurements, I can tell you that's just a bunch of bullshit. If we find out that you're an organ donor, it doesn't mean that we don't try to save your life. It doesn't mean that we're just letting patients die. Organ donation has had a long uphill battle, and articles like this one that the New York Times wrote just really cause it to backslide severely. You'd get worked up if someone in your profession did something that reflected negatively on your career that you love so much, like as a whole. Hey guys, gals, and non-binary pals, I'm your host Hannah, and this is Under the Scrubs. Y'all, it's not been a fun week. I got a nasty rope burn on my hand, and unfortunately I would love to say like it's a really cool story or I don't know, something kinky, something, right? It is from my dog's leash. Fern loves the chance to get to act a fool like she's never had a single day of training in her life, and now my hand's all jacked up. But I was able to go golfing, so no dickhead kids stole my ball. I think it's mainly because I bought them and they were hot pink and glittery and girly, so, you know, no one was going to take it. Don't like the fact, though, when we went, turns out when you go golfing and there's just two of you, they put you in like a little foursome. Okay, I don't want to be paired up. If I wanted to, can you just like give me the option to sign up for that? Now, don't get me wrong, Eugene and Jeff, very nice, but turns out we are super slow and we're not very good. So, you know, I kind of felt bad for them because they're obviously retired and they golf multiple times a week and they're very good at it, and we're just absolutely sucking it up. I probably lost like 7 or 8 balls total, and it really annoyed oh my God. It really annoyed the shit out of me because I had made the comment. I was just texting my mom and I was like, oh, I think I've lost like 4. And Chris was like, I think it's like 7 or 8. He starts counting them out. I'm like, okay, listen up here, champ. Unless you want to walk the rest of the course, like I suggest you dial it back and say, I only lost 3 or 4, okay? I don't want to hear it. I need to get new ones, and turns out they are kind of pricey. Okay, they're pricey if you want to get the cute ones, which I do. I will always continue to buy the cute little pink ones, mainly because I don't want people to steal them, but also it just gives me a little edge, okay? Leave me alone. Probably gonna end up ordering them off of Amazon, as much as I don't like Daddy Bezos. So I found out if I don't have to leave home, I never will, okay? We ordered groceries for the first time like a couple weeks ago, and god damn do I love delivery services. Like, I probably will never leave, all right? I just need to like mentally offload, hang out at home. I'm a homebody now, so I will forever be delivering or ordering delivery services to my front door, please and thank you. For this week's timeout, I just want this documented for the record, okay? When I took a leadership position and I told my mom, rightfully so, she was a little concerned. Not because I wouldn't do a good job, but I've made, como se dice, questionable choices when it comes to my words. I've learned you can't say things like, bitch, you got me fucked up, or don't speak to me the way you speak to your wife when you're in leadership. You know, I mean, you can't even say that as a nurse when you're working bedside. In my defense, I was raised feral in the night shift critical care, where you have to cope with dark humor or you're just going to die on the inside. So I'm learning corporate talk so that way I can replace my inside thoughts with professional phrases that won't land me in HR. So let's say when another supervisor at a different clinic reaches out and I was like, oh my gosh, like my office is just doing so great and our in baskets are so low. Do you want me to help you? I don't respond, oh, okay, so you're perfect and your clinic is perfect and you think you're better than me. I hope you get hand, foot, mouth. And instead, I would say, oh my gosh, we would love the help. Thanks. Instead of saying, you're annoying the hell out of me, get the hell up out of my face, I can say, I find some of your actions rather distracting. Instead of saying, wow, I told you so, and I definitely called that, I can say, the outcome of this aligns with my previous predictions. If this one's my favorite. I can't tell someone if I had ordered a truck full of idiots and only got you, I would have got my money's worth. But now I can say, help me understand what points need clarification and I'd be happy to assist. I've learned leadership is not for the weak, but luckily, thanks to childhood trauma, I'm really good at reading people. Just maybe not good at containing what comes out of my mouth and I need to develop more of a filter, but you know what? It's a work in progress, so back off. So this week's resources are Temple University, Beasley School of Law, Stroke Manual Nursing Center, Lex 18, LifeNet Health, and Life Center Northwest. I'm not affiliated with any of these people, but these are just who I've worked with dominantly in the field, so I'm going to use them as a reference. Now, there was an article that was written from New York Times, and it was written about organ donation. And honestly, it's like, yeah, it's dangerous, but it's also like really irresponsible and kind of stupid. It's called A Push for More Organ Transplants, Putting Donors at Risk. And it's basically like saying just a bunch of bullshit that like there's financial compensation if you get organs, kind of like alluding to hospitals basically just wanting to like kill people for their organs, right? I mean, they're really just reporting on like donation errors and like this whole investigation, and I use investigation like loosely, was based off of collections of interviews with literally like 55 healthcare professionals. And I say professionals because their credentials and experience not mentioned anywhere. The audio recordings that they used are cherry-picked at best, and they even used text messages as like evidence. So there's no financial incentives for organ donations for providers. It really kind of felt like clickbait. And I get a little worked up about it because I feel like it shits on the reputation for like healthcare and those that work in organ donation procurement, like that side of it. And I can say with my credentials, having worked critical care for numerous years, I've done numerous consults to organ procurement people. I mean, the amount of patients I've taken care of on vents that are critically ill that weren't going to make it off, having taken care of organ donor patients and having been in several procurements, I can tell you that's just a bunch of bullshit. Okay, like hospitals aren't killing you to take your organs. We're not sitting there rubbing our hands together when you come into the ER thinking, oh man, like I just can't wait to get your kidneys. No, I really hate seeing misinformation out there surrounding this type of stuff. There's like over 100,000 people on the transplant list right now, men, women, children, and 13 of them die every day waiting for an organ. It's easy to sit there and judge or play into the fear-mongering until it's you or your loved one or your own child that needs an organ, and then you get upset because you got these assholes all over Beyonce's internet acting a fool. And I really think sad thing is that we've kind of lost the ability to critically think. So when this article came out, the amount of people who just took what it said, turned around, and regurgitated it to kind of help spread that disease, essentially, or I'm going to call it a disease. It's really sickening. Like, you just didn't stop to, like, look at your research, look at the person who wrote it. Like, you know, the people that weren't credentialed or that, like, they didn't mention their credentials. What if one of them was a janitor? Like, if a janitor walked by, popped his head in, and told you, hey, I know your mom just had a stroke, but you know what I think she would really benefit from? Some Keflex, an antibiotic, right? You'd be like, what? You don't know anything. Get the hell up out of here. So I just, I know I'm going to preach a lot about making sure you go over your research and with a fine-tooth comb and like, is this even like credible? Never once in my entire career have I ever sifted through patient belongings to find their ID and look if they're an organ donor. Most of the time, if I ever had to go through their stuff, I usually had like my CNA go through the patient bag and we just would document what's in there. And it's basic stuff like shirt, shoes, underwear, phone, wallet. Like, we don't go into detail about what we find. That way, I've had patients be like, hey, I don't know if I came in with a robe, and I can go back and I can look and be like, oh no, this is what was documented that you came in with. They'd be like, okay, cool, right? Like, it just makes it a little bit easier. And that way too, like, let's say you did come in with like an iPad and now all of a sudden it's lost. We can be like, okay, well, they came in with it. It was documented, therefore, compensate them or whatever it is that hospitals do for that kind of stuff. I feel like in this era of life right now, we really need responsible journalism more than ever. And I kind of really just think it makes you look like an asshole when you speak about things that you really don't know anything about. Simple as, I judge you. All right. If you come to me and tell me that you don't want to be an organ donor because hospitals won't save you so we can have your organs, or that you're not going to get your child vaccinated because it's going to turn your kid gay because you heard about it on Fox News, it's a really good thing that I got Botox in my face, because the look of judgment that I have to give you, it's not great. I'll just say this. If you look like you used to get science tests handed back to you face down in school because you usually failed or had a really bad grade, I'm not going to be taking any kind of like medical or science advice from you. Now, let's say I have a patient, and this is made up, but like I have a patient that's admitted. They had a nasty accident, something had happened, EMS pulls up on scene, codes the patient, transports them to the ER, gets ROSC or return of spontaneous circulation, so your heart starts back up. And now you're admitted to the ICU on a ventilator and like whatever else you need to keep you stable. I've had patients that, they come in and you can, just based off of experience, you can tell like, okay, it's probably not going to be great. If they show up and, their Glasgow Coma scale is like a 3 and you're like, yeah, this isn't going to be pretty. The thing with medicine though, is that we have the ability working in this to look at the patient history, the current problem, labs, imaging, whatever it is that we need, and kind of come to like a logical conclusion about this patient, right? We don't have the emotional attachment that their family or loved ones do. We don't have 30 years of childhood or, 15 years of being married, or, oh my God, this is my baby. I mean, we can still provide kind and compassionate and thoughtful care, but this is someone that we just met. So it's easier to think logically rather than emotional. For example, I found a lump in my dog's groin and I immediately started crying, and I jumped to, oh my God, it's cancer. And if I allowed my emotional side to win, I would have taken Fern to either a human ER or vet ER, brought a gun with me, and told the staff, you fix my baby or we're about to be on the news up in here. All right. I'd be consulting an Etsy witch to tie our lifespans together, or I'd just be doing some wild shit, right? Because I'm reacting out of emotion. We are waiting for her health insurance to kick in so we don't have to empty our wallets to provide the care she needs. And if this is considered pre-existing, they're not going to cover it. Logically, we need to wait. It doesn't bother her. She's living her normal life. She's not acting any differently. Logically, it's probably a lipoma and harmless. Logically, we got the health insurance because I would have zero issues paying whatever I had to for Fern or even the cats. I'll bankrupt Chris and myself. I'll steal from my family. I'll learn how to hack and code and embezzle money from Jeff Bezos if I had to in order to pay for my animals. Illogically, it's cancer and she has days and she needs it out right now. We need to go to the ER vet. We need to call poison control. We need to call 911. And I can go on, right? So there's 3 areas of your brain divided by the triune brain. There's like the brain stem, or called the reptilian brain, and that just is like basic function that you need for survival. Breathing, digestion, your heart or heartbeat. There's neocortex, and that deals with attention, logic, analysis, and perception. And then there's the limbic system, which manages emotions, behaviors, memories, and motivations. The emotional brain does play a big role in decision making. Emotions are designed to quickly take an experience, condense it, evaluate it so we can make that decision. That way we can then rapidly respond to the situation. The limbic system has nerve pathways that go throughout the body, which allows a lot of influence to many of our own biological functions. So like strong emotions can cause powerful sensations like, butterflies in your stomach. Clara Harris, she was a Houston dentist. She walked in on her husband having an affair with his receptionist. So Clara did the next logical thing and she ran him down in her Mercedes. Homegirl was thinking about her actions, let's be real. I think there's like that notion of like being in such an anger or emotion that it overrides logic, but like be for real, right? You can't take the logic out of thinking, unfortunately. It's actually a really small pilot study that was looking at people who had limbic system brain damage and that they struggled with decision making. So I think it's got pretty good legs to take that pilot study further. But all of that to say, as far as like making a decision regarding your loved one's care, this usually isn't like the topic of donation or anything isn't discussed until much later, right? Because you're going to want to make a decision based off of emotion and not logic. So if you are in the ICU, you were just admitted, I would call the procurement center and I'd give them just like my info, a little bit of like what's going on. And then they pass that along to one of their coordinators or reviewers. That's like a nurse or someone that's like in the medical field. And then they usually call you back. And then you talk a little bit more in depth about what's going on, what happened. And then they'll actually be the one to tell you if that patient is a suitable donor. And if they are, they'll check in every so often. So like, let's say I'd be back the next night. They would call, be like, hey, how's the patient doing? I'd give them an update. And so it's kind of a day by day thing. But the first time you call the procurement team, and I mean, this is with the first call and the second call with the reviewer, the last thing they will tell you as you're getting off the phone, and they say it multiple times, do not mention or talk to the family about donation. Don't even think about it. Don't mention it. Don't even do any of that shit. Don't. So days go on. And, you're on a ventilator. We do something called a spontaneous breathing trial to see if you are eligible to like have that breathing tube pulled. We lower sedation. We talk to you as you are kind of waking up, coming to, keep you nice and calm. So that way, if you remain calm, we can pull it and everything looks good. If you're getting buck wild, we can't pull it. The risk for reintubation is too high. So as we start to lower that sedation, what we're also doing is just kind of looking neurologically what's going on. If you're not reaching up for your breathing tube to pull it out, something might be going on. So we, as your healthcare team, are going to ensure that there's no reversible causes as to like why you might not be waking up or responding. And so there's two pathways for organ donation. The first one is brain death. If the patient has lost 3 or more brainstem reflexes, this would be a clinical trigger for organ donation. So do they have a cough or a gag reflex? If no, then that would be a loss of the medullary function. And this is important when you're looking at medullary and vagal nerve integrity. You can like press on the eyeball for 10 to 20 seconds. You're looking for if the pulse is going to drop more than 8 to 10 beats per minute. And that reflex actually looks at the integrity of the caudal brainstem. If you move the patient head side to side briskly, do their eyes track or do they stay midline? This one you have to ensure that the patient's not on any barbiturates. But if it's absence, your lower pons has more than likely herniated. You would lower the patient's head at the bed and kind of turn their head a little bit to the side. And then you would put like super cold water into their ear and watch their eyes. If their eyes initially turned towards the side that got the water, and then they had like a horizontal nystagmus to the opposite side, that's great. But in brain dead patients, the nystagmus is not there. And nystagmus is eye movement that's involuntary and it's rapid and repetitive in nature. So in that case, it'd be going side to side pretty fast. You can tap the chin, or you can use a tongue blade and you rest it on the lower teeth, but you tap that with a reflex hammer while the jaw is slightly open, and a brain dead patient wouldn't react with the upward movement if the middle pons wasn't damaged. Are the pupils fixed? Do they react to light? There's something called doll's eyes, and so you move the patient's head again side to side. And if the eyes move in the same direction or they remain midline, that would indicate severe brainstem dysfunction. You can tap on the forehead if there's contraction of the orbicularis oculi muscles. Basically, it looks like winking. Then, if you don't have that, then that reflex is gone, obviously. And finally, do you react to painful stimuli? If I sternal rub you or apply like a pinching pressure to your trapezius, if I hold a pen or a pencil firmly against your nail bed, do you respond to that? And this testing is done while the patient's completely off all sedation or a sedation vacation or a sedation holiday. And that's just to ensure that the patency of the test. This testing is done as part of the brain death protocol. Protocols usually have, like the brain death protocols usually have like three aspects to it. There's clinical signs of brain death, there is a known cause of brain death, and then proof of irreversibility. And so you want to rule out reversible causes, like is the blood pressure too low? Is there severe metabolic and endocrine dysfunction that's not fixable? Are they hypothermic? Is there medications that would cause a suppression of the reflexes, hence the sedation vacation? So the only imaging that's now kind of like approved is a transcranial Doppler sonography. That way you can see visually the cerebral circulatory arrest, like that blood flow stopping to the brain. As of 2023, the American Academy of Neurology, there's a lot of the imaging they've said not to use as an ancillary to diagnose. But I know we still do, CAT scans with angiography or MRIs to help kind of aid in that diagnosis. And that's really to make sure that we're ruling out any other irreversible cause. There's also EEGs that you can do, evoked potentials, or a cerebral perfusion pressure monitoring. But, this whole process all in all takes time. It's not just done in a day. So like I said, we're not standing outside your room, rubbing our hands together, planning on killing your patient so that way we can get your organs faster. But when brain death is confirmed, that's actually the day and the time that goes onto your death certificate. So when it comes to time about asking about donation, there's the clinical triggers that we talked about, but it's also a lot of planning. You want the hospital team. So all the providers, the nurses, social work, spiritual care, palliative care, anyone who's really interacted with the family and has knowledge, and then the procurement team. The procurement team has its own specialists. They've got family support specialists. They've got the organ recovery coordinator. They have a hospital development program manager, and they all kind of come together and bring up the topic of donation. The conversation's always done in a really respectful and professional manner because, it's a sensitive time and it's devastating, for that family. If you are a registered organ donor, this does serve as an authorization and family is provided with full disclosure. If you're not registered, then the family will still be asked and conversed with. If you're worried about organ donation, you can actually register your decision to join or take yourself off or even set limitations whenever. I'll have that website and that information tagged in the show notes just, in case hopefully you don't take yourself off, but, just if you want to look at that a little bit further, they do ask that you call them and they can give you more information on it. And I just really want to reiterate, if we find out that you're an organ donor, it doesn't mean that we don't try to save your life. It doesn't mean that we're just letting patients die. So I'm probably going to drive that idea home quite a bit. The other pathway for donation would be a circulatory death. So same thing with the patient on a ventilator, some kind of devastating illness or injury, the loss of 3 or more brainstem reflexes. But if the neuro exam isn't quite consistent with a brain death, then the physician and family, they'll talk about a grave prognosis and the possibility of withdrawing life support. And this is if you're maxed out on a bunch of 4 different pressors. I've had to consult Jesus as, one of them, because we're about to start the last one. And I've seen some hot debate on how many vasopressors there are, but for my days, there's 5, okay? Got norepinephrine, phenylephrine, dopamine, epi, and vasopressin. So cram it down your cram hole, Paul Blart. Now, when the patient is going to go through an organ donation, they are essentially discharged from the hospital to be readmitted under the quote-unquote care of the procurement team. They don't actually leave the room they're in. It's just kind of a transition of care to the procurement team because there's just certain things that they need to have done to make sure that the organs are still good. So your blood pressure needs to be so high to make sure that the rest of the tissue in the body and the kidneys, everything is perfusing the way it needs to. They're working on matching patients with people on the list, and then plan a time for all of the teams to arrive and get the OR time for the procurement. So if you're going through a brain death route, the family does say goodbye into the room. If it's circulatory, the family actually does come down to the OR, and we usually get the patient onto the table, get them, kind of set up, and then family comes in and they sit with them. Life support will be removed, and they, like I said, family gets to be with them the entire time. We'll monitor vitals, and when we remove life support, there is a certain time frame that the patient is expected to pass. If the patient does not pass, or expire or become deceased, whatever your terminology is, if they do not pass within that certain amount of time, they're actually moved back to the ICU, and then you pursue comfort measures from there. So that's, getting your, if you need Ativan or Versed or morphine or whatever, we make you comfortable, right? If the patient does expire within the certain time frame, the family usually says their goodbyes and they leave the room. And then we have a 5-minute observation period for that patient. They remain on the monitors, and this is just to ensure that the heart does not restart and that there really is no signs of life. And I mean, it is like a strict, nobody touch this patient. We are waiting, we are watching, set a timer. And then once that period is up, that's when the organ donation begins. And it's such, from the ICU room to the OR, there's an honor walk. And it's such a juxtaposition because one life is ending, and you know that dozens of lives will be saved or changed because of that. There are causes that you can donate to more than just organs. You can do tissue for transplant research, education. Like in the OR, we use a lot of like the allograft implants. We use hamstring grafts for like ankle reconstruction. We use biologic implants for trauma, craniomaxillofacial, orthopedics, sports medicine, vascular, spine, dental, wound management, and cardiac surgeries. So if you go to get your ACL fixed and you don't have good tissue or you can't use your own graft, then we use somebody else's, right? So where do you think that comes from? In the room when you're getting ready to withdraw life support, the organ procurement coordinator usually reads like a story about the patient. We might play their favorite song, have a moment of silence. It's really just like treating them with the utmost respect because of their selfless gift. It's an incredible sight to see medicine and technology merge in like that one room, and to hear the teams that are there getting ready because they're taking their organ and they're going to go take it back and change someone else's life, like the heart. So when you are donating a heart and that is being taken out of the patient, it's going into another patient that day. And a lot of the times, like, you're hearing these teams call and like, hey, can you get the patient ready? And so you just know that like, as you're sitting there grieving the loss of this life, somewhere, somehow, right then and there too, someone is crying and they're thanking God and thanking whoever, or they're just so happy because they're getting a heart and they've been, on a list, or that they really need one, or, you know what I mean? It's kind of a weird but incredible feeling and thing to witness. I unfortunately do need to break this episode up into 2 parts. I want to do this justice. Organ donation has had a long uphill battle, and articles like this one that the New York Times wrote just really cause it to backslide severely. I hate hearing misinformation or just piss poor journalism do such damage because, like I said, it's not just organs that you're condemning. It's like all of the procedures and the lives that it saves through soft tissue procurement too. Like, we do research, we do education on these kinds of things. Like, these are really important. And like when you write something this irresponsible, you're just shitting all over it. So, like, as my mom says, like, shame on you. I'm going to get my mom out there. I'm going to get my mom to write you an email, New York Times, and then she's just going to say, shame on you. And I hope it hurts as much as it used to hurt me when I was a kid. I think it was stemming from this story where in Kentucky there was a man who had been taken to the OR for organ donation, and somewhere along the line, I guess he was still alive. Initially, he was admitted for an overdose, and family said that during the honor walk, he had opened his eyes and started tracking. Family was told that they were brain dead, but then somewhere there, he was documented as a circulatory death. But then he was brought back from the OR to his room, and the procurement center basically said, oopsies, my bad. Now, there are parts to the story that I'm going to need more info on. Like, what was the official, death? Was it brain or was it circulatory? What investigatory testing was done to support that? Supposedly a surgical preservation coordinator for the organ procurement team had told the family that he was taken to the cath lab and paralyzed and sedated, but the cath lab's not the OR. That's where you wouldn't take a organ procurement there. There's just like a lot of gaps in the story, but it sounds like either protocol wasn't followed or it was and it needs to be updated. But from an educated guess, he was labeled as a circulatory death. He did not pass in the amount of time that they had allotted and then brought back. I mean, the poor guy suffers from PTSD and his family is advocating for organ donation reform. I'm not sure what that looks like, but I do get worked up about this kind of stuff. I'm very passionate about healthcare and nursing and taking proper care of people. You'd get worked up if someone in your profession did something that reflected negatively on your career that you love so much, like as a whole. I am a firm believer in organ donation. Have seen it firsthand. I've participated in procurements and I've taken care of people who died waiting for an organ donation. In reality, there's only 1% to 2% of people that are actually acceptable donors. So to feed into this fear-mongering aspect and have people commenting on your stupid article being like, oh my God, I'm taking myself off the list because the hospital won't save me. Ugh, be so for real. I hate having to argue against this shit. I cannot tell you the amount of times I've had to educate patients that no, you're not going to get HIV or AIDS from blood transfusion. Times have changed now. We have hand soap. You know what I mean? Or not so much hand soap. You know what I mean? Times have changed, okay? Shit's not the same that it was 30 years ago. I understand that, maybe it was a problem, but we Gucci now. So if you want to join me, I'm thinking about starting a petition for there to be pseudoscience hospitals. So you can go there for all your other medical needs, but then when you need actual medicine, you have to come back and apologize and sign a waiver that says, I will not be stupid anymore. All right, I'm going to start that petition. Next week, I'll just cover up more about the donation process, the teams that show up, and kind of what their role is, and honestly, some of the really cool machines and technology that they have, and just wrapping up my soapbox rant. I also have exciting news to share next week, because by that point, I'll have told all my family and close friends. So no, I'm not pregnant. Okay. All right, so catch me next Tuesday. How about that? And I will see you next week. Okay, love you. Bye.